Originally, we were planned to come live on November 6th, but with all of the news and changes this week, we're coming to you today, October 30th, to give you an update. So we have our Public Health Officer, Dr. Andy Corrin, with us, Becky Emery, our Department Operations Center Manager. And with that, I'm going to turn it over to Dr. Corrin for today's COVID-19 update.
Hello, everybody, and hope you notice I'm wearing a red shirt because we are now in the red tier. I'll start with the data. As of yesterday, we had a total number of cases of 1,093 cases cumulatively, of whom 729 were in the Latinx community. That's 67%. We have 107 in quarantine and 39 in isolation. We have 3 people in the hospital. One is a Latinx community member, none in the ICU, and only 1 in a hospital in Mendocino County. The other 2 are out of the county, and we have had 21 deaths in the county so far. Our case rate average over 7 days with a 7-day lag has been low enough that we are now in the red tier. Currently, that number is 4.57. We have had some outbreaks, but they were controlled last month. And just recently, we had an outbreak in Fort Bragg that involved 6 original cases and 19 close contacts. We've completed our outbreak testing and should be getting results in the middle of next week. I should say that the red tier assignment was a little bit out of the context of the reported numbers, but we realized that the state had looked at their numbers and then multiplied our case rate average by a factor because we had done such good testing. Our test positivity rate was very low, and so we achieved the red tier. The next tier would be an orange tier, and then following that is yellow. What the red tier means for us is, with limitations, we can have indoor worship now. It's at 25% or a maximum of 100 people. Restaurants can be open at a 25% occupancy or 100 people, whichever is lower. Indoor retail has gone up to 50%. Personal care is indoors. Movie theaters and are also indoors. Gym and fitness centers are now able to be held indoors at 10% capacity. And that includes fitness centers that are in hotels or other lodgings. Also, the skilled nursing facilities and acute care hospitals are beginning to plan inside in-person visitation. They have to arrange, they have to figure out which patients that would apply to and figure out how to actually do that. But that's a great benefit for our elder people who are in chronic care. There have been a number of questions about playgrounds, and they are able to open in red, but we have problems with the city staff being able to staff them and have safe cleaning procedures. But my hope is that that'll happen as soon as possible. I want to reemphasize that testing is very important. It is one of the main reasons why we were able to achieve a red tier status. There has also been a lot of concerns recently because the Ucsf, which was providing some of our testing, decided that they were, or announced that they were going to end that on October 31st. But we were able to petition them, and they have agreed to a short extension. It won't be all of the numbers of tests that we have had, but we are hopeful that it will successfully bridge to our new testing possibilities or contracts that we have coming up. So we have had OptumServe at the fairgrounds here in Ukiah, and we have applied for another OptumServe contract, which we hope will be approved, and we'll just extend the current OptumServe service that we have. But we've applied for another OptumServe lane, which we hope will be approved and will be a traveling program that will go from site to site around the county. In addition, the business community, chambers of commerce, and lodging industry and ranchers are planning some workplace testing also. And how rapidly that happens, it looks like they're closing in on those possibilities, and we're very excited about that. Also, we have received a new rapid test called Vinex Now, and that is not the PCR testing that takes a long time. In fact, the results are available in 15 minutes, and in the future, it is hoped that it will be very inexpensive, $5 per test. But at this point, it's free in our clinics. It's for use for people who have symptoms less than 7 days. And we're hoping that everyone who has even mild symptoms will call their provider and get this test. That will help us to rapidly identify any people who really are positive with COVID and mitigate and prevent outbreaks. I'd like to just talk a little bit about presenteeism, a new word, the opposite of absenteeism. So presenteeism is the dedication of people who want to go to work. They're a little bit sick, but they say, oh, I can make it through today and I'm gonna go to work. This is, at this point with COVID, not what we want. Get tested, be cautious, and protect your coworkers and your community. So presenteeism is not so good. Outbreaks, the outbreak I mentioned at Fort Bragg has been, we've done the outbreak testing and are waiting those results. The other outbreaks that were present the last time I spoke in Covelo and Point Arena are controlled, and we consider them closed cases at this point. So as we go forward, I am going to say again, I'm cautiously optimistic. Our county has earned this red tier. We've been opened for, or we are opening now after 6 very long months of being in near total lockdown. And of course, I have heard some gripes, but by and large, our communities have been learning the new behaviors for a new reality, which is with COVID, and it hasn't been easy, but the hard work paid off. And I'm very proud and very happy to say that we have finally achieved the red tier. Now, this is not a be-all, and it's not done. We can be turned back to the purple tier if we don't continue our good record of low weekly case rates. And what are the challenges coming up? Holidays, of course, and the gatherings at holidays. You want people to be happy, to decorate their houses, decorate the pumpkins, dress up, participate in organized celebrations that maintain distancing, using masks, but avoid trick-or-treating, which has people congregating around the doorsteps, or trunk-or-treating, congregating around cars. If we don't do that, we're going to have more outbreaks, and we'll turn back to purple. Someone will get sick, someone might have hospitalization or die. So stay in your cohorts. Remember, household cohorts are up to 12 people that can gather. More is riskier than that. It is safer to be outdoors, windows open, increasing circulation indoors, using masks, social distancing, and washing, and all those hygiene precautions. Schools may be slowly opening, slow, so that all the new procedures that they're going to have to put in place, including testing staff, screening students, maintaining small groups, and planning all of the what-if scenarios. This all takes some time, but our school boards and so forth are working vigorously on this. And we know that it'll be a great boon to the children and the families, but it has to be done safely for everybody. The cold weather is coming, and that's another challenge because there's going to be more activities that are going to be indoors, and that means that there'll be more risks indoors. And of course, the influenza season is coming, and I want to just emphasize, get yourself and your family vaccinated. Do those vaccinations through your primary care providers, through the clinics, through the pharmacies. The Department of Public Health will be having some more drive-through influenza vaccine days. If there are reservations and hesitancy about getting vaccines, talk it over with your primary care provider. Vaccines have made a huge difference in the world with influenza, but also preventable childhood diseases like polio, diphtheria, tetanus, whooping cough, hepatitis, meningitis, and cervical cancer. Some of those things we hardly ever see anymore because of vaccines. Yes, side effects can exist, but they are minuscule in comparison to the death and disability that we used to see with these diseases. So this is also the first time we're going to see the usual seasonal pandemic influenza alongside of the pandemic COVID. And I am very concerned. I think we're all very concerned. Masks don't protect like vaccines do. We could overrun our hospitals' ability to take care of people with non-infectious diseases like heart attacks, strokes, cancer, lung diseases. We wear masks and distance to protect ourselves and to protect others. So mask up and vaccinate. There are also challenges, as we can see as we look around the world, of surges in Europe, in the Midwest and in the South in the United States, and in Southern California. So this COVID pandemic is not over, and we could see a very huge surge and second wave that could be disastrous for us. The outlook for vaccines for COVID, they are now planning nationally and in California, and even locally, though there's no final approval of any vaccine yet. When it comes, there'll be questions about safety, effectiveness, duration, boosters, and problems with distribution, which is no small thing. The estimates are that we may see our first vaccine efforts in the spring, and it'll be probably 2022 before we're actually attaining significant community immunity rates that may return our activities to normal. So in the meantime, use your masks, keep a safe distance, wash and disinfect, and ventilate as much as you can outside, open windows. For people who are really feeling very stressed, don't forget we have a warm line that's open Monday through Saturday, 7 a.m. to 6 p.m., 472-2311. And for questions or other about the health orders and lab results, our call center is open 8:30 to 5, Monday through Friday, 472-2759. The last thing I want to talk about is vote. Everybody vote. Use your masks and your social distancing and be careful, but please vote. And for the next section, I'm going to turn it over to Becky. We'll talk about Great Plates.
Thank you, Dr. Corin. With the transition in tiers, we still want to make sure that our community is keeping safe. In April of this past year, Mendocino County joined with the state to help provide meals to our seniors 65 and over, as well as anybody that's at risk and 60 years and older. And if those individuals are unable to prepare meals at home, the Great Plates program can assist. It is a partnership with our local restaurants in Mendocino County and delivers 3 nutritious meals a day to qualifying individuals. Currently, we have 5 restaurants throughout the county that are participating. We have 4 over on the coast and 1 inland. And we have pending applications for 2 more. We are consistently looking for more partners in this effort. To date, this program has generated over $2.6 million in revenue to our community and supported 384 people daily in getting meals. We are continuing to take applications for those in need of meal delivery, as well as restaurants that are wanting to partner in this effort. Anyone interested in applying to receive these meals or be a provider for the meals can contact Adult and Aging Services toll free at 1-877-327-1799 or apply online at mendocinocounty.org/greatplates. We really want to make sure that everybody is staying safe and still doing their social distancing as we're moving through these tiers.
Thank you, Becky. So before we start taking some questions from our media outlets, I just want to let our viewers know that if you have questions, you can go ahead and leave them in the comments, and we'll try to get to as many questions as we can today. So again, if you have questions, just go ahead and leave them in the comments. And after we take our media questions, we'll get to some of yours. So with that, I'm going to turn it over to Sarah Reith with KZYX. Sarah?
Hi, thank you. Dr. Curran, I'm wondering if you could go into a little bit more detail about the testing contract. You talked about the Binax Now and the rapid test, and I'm wondering if that's something that people can administer to themselves or if it needs a professional medical setting, and if there are more contracts that that have been signed off on for sure aside from that.
Okay, so let's address the Binax Now first, and then the other contracts. Binax Now has been distributed by the federal governments to the state, and the state is already distributing it to the county, and we're distributing it to our clinic partners. So it's a test and it's ongoing. It is a very recently developed test, and though it is very easy to perform, we think, being that it's new, it has to be done under the auspices of what's called a CLIA waivered lab. That's a type of licensing that's done. And the reason for that is to just make sure that people are following the instructions, there's some quality assurance, and that we also have a way to see how it's working actually in the field. But it is a nasal swab, and then the operator takes a card. The operator is, the technician takes a card and puts a few drops in one little well that's formed by the cardboard card and another piece of paper underneath. And then the swab is twirled on that to release some of the antigen. And then they're simply waiting for another 15 minutes to get the results. I don't know if anybody here remembers, but this is almost as simple as some of the old pregnancy tests. It's not yet at the point where it's sold over the counter and can be used in the privacy of your own home, but it's a similar technology. So the hope is in the future, it will be an over-the-counter test. You can use it in your home and it'll be fairly inexpensive. That would be fantastic, but that's not where it's at now. We're very happy to have it and to start using it. And yes, if you have any symptoms at all and you're concerned, call your primary care doctor. Or the clinics will have it now. As far as the other testing goes, like I said, UCSF notified us and gave us about a week and a half saying that their tests were no longer going to be available, and it was going to be October 31st. The clinics and ourselves reached out and got in touch with the appropriate people at UCSF, and they have agreed to give us a reduced number of those tests over 2 weeks so that we'll be able to get in place our other surveillance testing modalities. So that's a temporary extension that we're very pleased to have. The other testing modality that we have had in this county has been OptumServe at the fairgrounds, and that has been accessible to people who can come into Ukiah. And we are going to continue that. The current contract doesn't end until the end of November, and we have applications to continue that OptumServe service. And in addition, we have an application to expand that service to a traveling service that will move around the county and be accessible to all the people around the county. And again, this is for surveillance testing. We like people to do it as much as they can, because if we find an occasional positive, then we can contain that positive and really prevent a significant outbreak with isolation and then quarantine of close contacts. At this point, we don't have those contracts for OptumServe yet, but I'm fairly sure that we'll get it, but I don't want to make promises because we can't make promises. And that's where our surveillance testing is at this point for our county.
And the extension for UCSF is 2 weeks. Is that 2 weeks from today, or what's the exact date that it's been extended through?
Becky, do you want to answer that?
Certainly, it's been extended through November 15th.
Okay. All right. Well, my next question was about the timeline for OptumServe, but you already covered it. So thank you so much.
Thank you, Sarah. We'll move over to Susan with the Independent Coast Observer. Susan? And you're on mute, Susan. All right. Oh, here we go.
There she goes.
Sorry. I unfortunately was having a technical issue and I came in a little late on this. So I may be asking something that you already went over, but I was curious, the numbers that the state used to move the county to red did not seem to match the numbers on the county dashboard with the 7-day lag and the 7-day average. And I was just curious what you had to say about that.
Well, that's a good question. The county, we keep very close records, and the state keeps their records, and they may not necessarily match up. However, the reason that we went to red with the numbers that we had is because we had very good records of testing. So our test positivity rate was low, but the numbers of tests was very high. So they were able to use a multiplier against our 7-day average, 7-day lag case rate, and we still came out with red, in the red tier.
Okay, so I'm still confused. Sorry, I don't mean to be obtuse, but I've been following that dashboard every single day, and the numbers just did not jibe with the numbers that the state came up with. I called the State Department of Public Health to discuss it with them, and I did not get an answer that made sense to me. So I'm hearing you say they used a multiplier, but I still don't understand it. I mean, they created this tier system, and Mendocino County, it seems to me, has been very religious about chronicling statistics every day. But, you know, Monday we were purple with 8.29 cases. And Tuesday we were in the red tier with something like 4 cases. So that just didn't make sense to me.
Well, first understand that it's not a daily case rate. We're looking each day
Right.
at what it was a week ago and averaged over a week. But
Right.
beyond that, the state really does have some variance from what we collect. There are a number of reasons why that can happen. But the main reason we believe that we achieved the red status at this point was because of our testing rate, which was, we were down in the orange and yellow area. And so being in a tier depends on both the case rate, the daily case rate, and it's the average 7-day lag, and it depends also on the testing rate. And so when they looked at our numbers, we were on the borderline of purple. We were on purple, but we were actually in the orange zone and low in the testing rate. And it's our belief, and again, they just published their spreadsheet, so we can't always go back, and just like you can't go back with them and say exactly how did you do this. They don't have that answer. We go by what the state says, but we believe that it was this multiplication of the factor from our test rate and the case rate.
Okay. Thank you for that. Also, one more question. Is every case getting counted, as far as you know?
As far as I know, it's getting counted. If anything, our concern is that there might be duplication. So we go through all of our line lists and compare it to what the state has, and we eliminate any duplications. But yes, we believe that all positives are counted.
Thank you.
Thank you, Susan. Moving over to Adrian with the Mendocino Voice. Adrian?
How you doing, Doc? How you doing, Sarah? Thanks for taking our questions. I wanted to ask you first just a sort of a simple mechanics question about school opening. So it's my understanding that the schools have to wait 2 weeks of being on red before they can open. When do they count? When does that count start? So when is the date on which schools can officially change those policies? And is there a tripwire? Is there a different tripwire to send them back into some set of restrictions that's different from the tripwire for the county at large?
Yeah. So let's first review the dates. Oh, I had written all this down. The precise dates that that they use to calculate our.
So Dr. Corrin, I can assist you with that.
Oh, good. Go ahead, please, Beck.
We were notified and activated into the red tier effective the 28th of October. We have to be in the red tier for 2 full weeks before the schools can consider whether or not they will be able to move to the next steps of opening. So that would put them at November 11th, which is Veterans Day. So the earliest they would be looking at would be November 12th for any plans that they may have. But that's really a very short timeline for them.
Now, going backwards was the second part of your question, I think. So if the county does not maintain the less than 7 per day average with a 7-day lag for this next period of time, and we have 2 weeks that we're exceeding that, then we can be pushed back to the purple tier. Now, because we're a small county, that's more of an absolute number than a proportion or a fraction, because we're less than 100,000 population. So we have a little bit of leeway in terms of moving backwards from a numerical point of view, and that was the equity calculation for small counties. For schools that open while we're in the red tier, they don't need to close when we go into purple. Our concern is if we go back into purple, they can't open until we're in red again. And then again, it'll be basically a month of being red. So although it's a short time to get them open, we're actively talking about what would be acceptable and can they plan it and do it that quickly. And there's a lot of factors that go into that. We want to open very safely so everybody feels comfortable, from the students to the teachers and staff to the parents. And it's going to gradually open with more and more students and faculty coming in and doing face-to-face learning.
Just to make sure I understand you, if we do go back into purple, the schools don't automatically close.
If the schools are open, they don't automatically close. That's correct.
Presumably, unless there's some other, if the outbreak is particularly bad, there would be some other kind of consideration. But within the algorithm set up, that's not the case.
If the outbreak goes over, I believe it's 200 per 100,000 as an average, then the schools do have to close.
Yeah, that's a lot. So my second question is, this might, I'm not sure if Becky or somebody else would have an answer to this, but it's about enforcement. Basically, given that things are less strict now, I think this is kind of paradoxical, but given that things are less strict, it seems like enforcement might actually be harder and a little bit more labor intensive. It's one thing to say nobody's in that building versus, oh, actually I have to go in there and count the number of people in the building to make sure it's below 25% occupancy. And so I'm wondering, somebody at the county or if the doctor, not sure who best to field this question, could discuss how that preparation is being made for to monitor businesses, restaurants, et cetera, in that way, because you can imagine ways in which people would flaunt that rule. You can also imagine ways in which people would take advantage of that rule and call in their competitor or something like that. So I'm just curious what preparations there are for that.
Well, let me start by saying that this is a huge change for the community in terms of learning new behaviors. And we have not taken a punitive attitude toward people who don't come along right away. It's taken a while to learn. And it's better that people learn and they learn voluntarily. And the people who are teaching our retailers and other people that they really need to get on the ball with the masking and the distancing and those kinds of things are a lot of times their customers. I went into a store about a week ago and there was nobody else in there except the proprietor, and he was not wearing a mask. He was sitting on a chair, not wearing a mask. And I went to the doorway and I said, do you wear masks in here? And I was prepared to leave, and he just got up, put on his mask, and that was it. And I think that happens a lot. When it doesn't happen that easily, people are calling into our call center, and we do send people out, and a lot of times we miss it, and we talk to the store owner or whatever the enterprise is, and we are able to achieve some agreement. A lot of times it's educational, and a lot of times it's just, oh well, you came, you're watching, and we'll do it. And so I think countywide, I may be wrong in this, but I think there may have been one citation at one point for a very egregious problem. And other than that, we haven't had to do that. So there have been call-ins that somebody's not following the orders. And usually by the time we get there, it's the problem is taken care of. It is true, it could be more difficult as we open to do a head count. We have started to do what we call secret shoppers. So we're using the department, the people who go around and make sure that our restaurants are keeping their food safe, and the stores that sell food are. Those same people are going around and looking, at businesses and seeing, are they complying, aren't they? There are certain things like signage that has to be there, and masking and so on and so forth. And at this point, it's educational. We're not going in there to slap fines on people, and that doesn't seem to be necessary. One of the things I said in my presentation, I'm very proud of our county because we've all done this together, and it's a hard thing to learn. It's not easy. Yes, there'll be people who griping this and griping that, but not that many. And usually that's died down, and people are really, uniting with this, getting behind it. And thankfully, because of their response, we're now able to do a little bit more opening. So I think that's a good thing. But what I said is we need to be cautious because we could turn around and have to be purple and close down again. But my expectation of people is everybody wants to do the right thing. Everybody wants to have a healthy community. And there are some inconveniences in how we get there, but a lot of dealing with that is educational.
If I could ask a quick follow-up related to the restaurant question, a lot of businesses have built substantial awnings outside, and there's been some zoning considerations that went into doing that in terms of sidewalk use, et cetera. I'm wondering if, at least within county areas, if businesses are going to be allowed to maintain that in case we do go back into purple and have to go back outside and that kind of thing.
Adrian, that's a really great question. I think it's something that our county planning and building and code enforcement are going to need to be looking into. I know that we are continuing to be cautious in moving to the red tier and what that looks like for us. So I think that's certainly something that will be looked at as we move forward, especially with the inclement weather coming. The other thing I would just say is, we are working and have sent out a press release to all the businesses to submit their business plans and are working very closely with environmental health and code enforcement to make sure that we are continuing the inspections and support to our community to help keep everyone safe.
And just to tack on to that, I believe it was at our last board meeting, the board adopted an ordinance that planning and building brought forward to address that concern, to make sure there's flexibility for businesses to have like outdoor spaces with the situation that we're currently in. So you might want to check that out, but they brought that forward at the last board meeting.
Thank you very much.
So with that, we're going to take a few questions from our viewers. So feel free to leave your comments down below. First, I've seen quite a few questions, again, asking more detail on school and when schools are going to open. So I'm just going to recap that information really quick. So we have to maintain a red tier status for 2 full weeks before schools can start the process to open up on-site learning. And so the soonest that would be, if we maintain this level, would be November 11th, which is a holiday. So on the 12th. So you definitely want to watch out for communications from your local school district, or give them a call about their plans for reopening. I know all of them are working really, really hard to try to get students back on campus as soon as possible. So check with your local school district, and if all goes well, 2 weeks and they'll be able to start that process. With that, we have a good question from one of our viewers. We are moving into the holiday season where a lot of people are traveling out of county to visit family. And this question is, if someone has to go out of the area and is around others, but no known COVID contacts, how soon after they return should they seek testing and feel safe to be able to go back to work and be around other family members?
Well, that's a great question. You know, when you're getting together with people out of town, that is a gathering. And so we try and avoid gatherings. That's the first part of the answer. And if you are gathering, it should be outdoors with masks and social distancing. And really the only gathering that we like to see happening is among household unit members, which is in our county less than 12 or 12 people or less. When you come back, it probably would be the last time you'd have contact with that group. You could count and in the next few days, you know, give it 3 to 5 days, get tested. That should give a good viral count to be able to say whether you're positive or negative. And you would do that through our OptumServe testing or the clinics if they still have UCSF tests on hand. So if you're symptomatic, do it right away, because then we would use that Binax Now testing. But if no symptoms, you may need to give it a little bit longer time for the viral count to get up. The other thing is, if you're living, you know, if you go away and you're in a gathering and you're coming back and you're with parents or grandparents or people who are more susceptible, you know, even indoors, wearing masks and keeping social distances for a while would be a safe practice.
We have another question from a viewer. How accurate is the rapid testing for COVID?
So, as I said, it's in development in a sense. I mean, it's being marketed, but it's earlier that it's being marketed than almost any other test I've ever seen. It's very accurate. So in the case of a person who has a high probability of having COVID, meaning they have some symptoms, then then we call the pre-test probability is high, and then the positive predictive value of a positive test showing that you really do have it is between 97 and 99% by the various studies that have been done. On the negative side, if you get a negative test, it's a little less accurate. There's more false negatives in that situation. But we are recommending to use the new test only in people who have symptoms that are less than 7 days long, and that gives it its best performance.
Thank you, Dr. Koren. Our next question is, who do we contact when we see a business not complying with masking and social distancing?
That would be a call to the call center, and that's the number that I gave before, 472-2759.
We have another question, and I'm not sure if we can answer this, but we can try. There's some concerns about how can schools reopen if the coast is losing testing capacity. So if we could just touch on, you know, all what we're doing to increase that capacity so we can test.
Yeah, so my hope is that we're not going to have a significant decrease in testing capacity as we go forward. If not the same, we may have more testing capacity on the coast. But also, there are many counties that don't have the testing capacity that we've been able to amass, and then we would have students and teachers and so on be screened before they go in. And if there's any symptoms, they'll be sent to their primary care doctor to be tested to see if they have a COVID positive test.
All right, well, that is all of the questions I see from our viewers. So just to recap a few things before we leave today, like Dr. Corin said, the election is coming up, so make sure you bring your masks if you're visiting the polls. If you need information on where your polling location is or safe drop boxes where you can go ahead and put that in there, you can visit our website, mendocinocounty.org/elections, or you can give our election office a call, and we would be happy to help you. And this weekend is Halloween, so remember to stay safe, keep your distance, wear your masks. And with that, I'll just turn it over to Dr. Corin for any final remarks before we say goodbye.
No, that's great. Thank you, Sarah. I just can't say enough how proud I am of the community, and keep up with the distance and the masks and all of what you're doing.
And with that, we hope you have a wonderful rest of the day, a safe holiday weekend, and we'll see you again on November 7th, or November 6th, sorry, Friday, November 6th at 2 p.m. here on the county's Facebook and of course on our YouTube channel. With that, we'll see you next time.